Right now, we have a dysfunctional healthcare system.
Medicare for All will fix that.
Provide a public option, meaning every single person in America would be able to buy into the option.
If there's one thing Americans have learned from the Democrats running for president, it's that the fight to fix the $3 trillion a year healthcare system is far from settled on the left.
There will be a public plan under my plan for Medicare and a private plan under my plan for Medicare.
We're being offered a false choice. Some who want to improve the Affordable Care Act at the margins, others who want a Medicare for All program that will force people off of private insurance.
For decades, Democrats have been working to get the government more involved in healthcare. And what to do now, since the Affordable Care Act seems to be sticking around despite President Trump's efforts,
repeal and replace,
is starting to really divide Democrats in the 2020 primary. If you only listen to some of the voices that are the loudest and furthest left, it sounds like the Medicare for All system is the most popular version on the table. But that doesn't seem to bear out in the polling. A mayor's survey found that while 64% of Democrats favor a Medicare for All system that would completely get rid of private insurance, 90% favor a system that just adds a public option and keeps private insurance.
A program run by the government or funded by the government where people, either because they can't get insurance through Medicaid or the exchange or private insurance, can go and get coverage at that option.
Which is not at all how Obamacare works now. That's Dr. Ezekiel Emanuel. He's a Democrat, and as one of the architects of the Affordable Care Act, was around the last time Dems discussed a public option as a way to fix our healthcare system. The public option was a part of Obamacare at the beginning, but some lawmakers, including independent Senator Joe Lieberman, pushed for it to get pulled.
The contentious public option appears, at least in the Senate, to be dead.
Which was one of the multiple fights that split Dems during the debate around the Affordable Care Act.
You know, the public option came out of nowhere. If you look at last year's presidential campaign, Bob, no mention of it. A public option will actually hurt the economic recovery and our long-term fiscal situation.
Joe Lieberman does come from Connecticut. Connecticut has health insurance companies, and I think he wanted to protect the private health insurance system.
There was a feeling from Democrats in 2009, including Emanuel, that any movement on healthcare was positive, even if that meant getting rid of the public option and taking a lot of the teeth out of the ACA.
There are certain things you have to sacrifice. You may not like it, but to get a bill passed, and getting a bill passed that moves us much closer to universal coverage, got 20 million people covered, that's worth it.
That attitude seems to be missing from the more progressive candidates in the 2020 primary, who are much more ambitious. The healthcare fight has clearly moved far to the left, with the public option being seen as too modest by many.
You know, I don't understand why anybody goes to all the trouble of running for president of the United States just to talk about what we really can't do and shouldn't fight for.
It's also not clear yet how a public option would work in practice. Washington State Governor Jay Inslee only signed the nation's first state public option in May. But that lack of clarity doesn't change the fact that healthcare is consistently the #1 issue for voters in poll after poll. It's one of the main reasons Democrats took back the House last year. So more progressive Democrats may have to tread carefully, because demanding the eventual Democratic candidate to completely bypass a public option plan in the primary when their option's popularity isn't as high as it seems could be risky.
I am worried about supporting Medicare for All or not being a litmus test. And I think we have to really strongly avoid that. You're for Medicare for All or we're not voting for you, we're going to protest you.